All right, let me say good afternoon to everyone. Pleased to have Mayor Pro Tem Dave Martin with me and Councilmember Carla Cisneros out of District H. Dr. Purse is going to be testifying before the Texas Senate Committee, and so I think he's getting ready to testify now virtually, so he's going to be tied up. Director Williams is with us today. Can speak to and answer questions as it relates to the vaccine and the distribution of the vaccine. And then Melinda Little is here with Comcast, the Government Affairs Director for Comcast, and we'll be making an announcement as it relates to them a little bit later on. And Janice Sparks with the Council Area Agent is also here. Where's Janice? There she is. It's right there. Let me just say for today, the Houston Health Department is reporting, Chief Pena with the Fire Department, and Gabe Caceres with the Mayor's Office with People with Disabilities. The Houston Health Department today is reporting 403 cases of COVID-19, bringing the total case count for the city of Houston to 101,300. We went over 100,000 this weekend. And today we're adding 403. The total number of deaths is increasing by 2. Those are 2 persons who have died as a result of COVID-19. And that brings our total count in terms of people dying from this virus to 1,467. And so you can't just look at any one day. You almost have to look at these numbers that we are reporting over several days, a week or two, to kind of get a good read, because as you know, yesterday the city reported over 1,300 cases, and today we're reporting 403. I also think it's important to note that over the weekend, I mentioned the number we reported over the weekend. We're also seeing the trends and monitoring things very, very closely. We do anticipate that the numbers will probably be inching up even more in terms of our reporting as we see the effects of the post-Thanksgiving Day situation. So we will see what those numbers will indicate. As we approach the Christmas holidays, Hanukkah, Kwanzaa, again, want to remind people to be very careful in terms of their interactions and to minimize their presence in large gatherings. And I'm also encouraging people who would normally hold their Christmas receptions, Christmas parties by companies and organizations. I would strongly ask that you dispense with those this year and find other ways of celebrating these holidays outside of these big holiday parties and those receptions. Those are just candidates for community spread, and so I will ask that you not do them this year. Today, the Houston Health Department is reporting its latest positivity rate of 8.8%. Last week, we reported 8.4%. This week is 8.8%. And again, this rate is a 14-day moving average and fluctuates daily as new testing data is received. So again, today is 8.8%. And I'm asking that we do everything we can to blunt the trajectory, upward trajectory. So we want to kind of stop it at 8.8 and then want to start moving that downward. The goal is to get to 5% and below. We reached it before, and we need to get back to it as much as possible. And so let me just stop right there. I'm going to come back. I'm going to bring up Director Williams to talk about the vaccines, the protocols surrounding that. We are hopeful that the FDA will approve the Pfizer vaccine on Thursday, and then shortly thereafter for the vaccine to start being distributed throughout the country. Director Williams.
Thank you, Mayor. This is just an overview of Texas COVID-19 vaccine distribution plan. As we all know, there are multiple vaccines being developed and manufactured within the United States. And the first vaccines could be cleared for use by FDA in the coming days and weeks. As a matter of fact, I think everybody has been hearing that we can expect some vaccine delivery sometime next week. Although everyone wants to get vaccinated, that will in fact be the case. But initial doses of the vaccine will be really slated for critical populations as identified by the feds and the state. If you look at this slide, it shows the priority, the guiding principles for that the state has produced in the vaccine distribution plan. First, protecting health care workers, protecting frontline workers, and protecting vulnerable populations. The initial allocation will be extremely limited, so it will be at least in the first quarter of 2021 before the first tier priority group is addressed. And the first tier hasn't actually been totally developed by the state. Only the first half of that tier has actually been developed. So it's an ongoing process. And looking ahead into 2021 with the next slide, it will be likely at least the second quarter of 2021 before vaccines become more widely available. When it does, people will be able to get vaccinated at their doctor's offices, at pharmacies, hospitals, and other usual sites. A vaccine will be distributed at no cost by the CDC and shipped directly to vaccine providers along with supplies needed to administer it, such as syringes, needles, etc. And I can say that both within the city and the county, we have approximately 500 providers that are either registered or going through the registration process. Each vaccine recipient will receive a card with information about the vaccine they received, and doses administered will be recorded in the state's MTRAC2 system. That is the state's immunization registry, so that providers and recipients can ensure they receive the correct second dose. Remember, if you get one vaccine, initially you really have, the second dose has to be that same vaccine. The Houston Health Department's roles, although the distribution is a state-driven process, there are roles for the Houston Health Department. Much like our testing strategy that brings resources into vulnerable communities, we'll have a similar approach for vaccines focused on access and equity. We also play a role in recruiting Houston COVID-19 vaccine providers in the state network, focusing on recommended priority groups and geographical areas within adequate coverage. And earlier I referred to the fact that we have currently about 500 providers either registered or going through the registration process. It's important to note that we can also monitor vaccine uptake to identify potential gaps and deploy targeted strategies to ensure vaccine is available to all Houstonians based on vaccine availability. This is exactly what we did during our testing efforts when we saw that there was either a slow uptake or there were high positivity zip codes. We actually focused our testing efforts into those areas. We will also serve in a traditional role as a safety net provider by providing vaccines in our health centers and our multi-service centers. We're also going to use what we call a strike team, our mobile units that will be able to move around into targeted areas so that we can make sure that we're getting ample vaccine coverage.
Thank you, Dr. Williams. I just want to emphasize at whatever point the vaccine becomes available where you can take it, let me encourage you to take it. So, for example, healthcare providers will be up first, but whenever it can get to the overall community, and when you're able to take it, let me encourage you to do it. Whenever I'm eligible to take it, I intend to take the vaccine. In fact, we'll do it publicly because we've encouraged people to get tested. We've encouraged people to mask up, to social distance, to wash your hands. Well, now we're adding another component to it, and that is we're encouraging people to get vaccinated. to get this vaccine. And it will do many things. Number one, it will help to curb the number of people who have to go to hospitals, the number of people who are being positive. We know we have seen a disproportionate impact on communities of color, low-income communities. And so by taking the vaccine, you end up not only just protecting yourself, but protecting others. So when it becomes available, I kind of want to start talking about it now, even before they start distributing it. When you can, I would encourage you in the strongest of terms to please take the vaccine. Now let me bring up Chief Pena from the Fire Department.
Thank you, Mayor. Good afternoon, everyone. The numbers for the Houston Fire Department continue to skyrocket. Today we are at 144 firefighters in quarantine and 36 that have tested positive currently for coronavirus. That continues to place an incredible strain on our ability to staff units as it has in the past 7 months. We, again, like the mayor mentioned, we encourage people to do the right thing to limit that community spread because it is really affecting public safety, not only fire department, but police department and all other municipal employees that are out there serving this community. So we encourage you to continue practicing the recommended safety guidelines, wearing the mask, proper distancing, and proper hygiene, which will help us stem the sharp increase in this virus. In regards to the occupancy task force, Saturday to Sunday in those 24 hours, we responded to 105 complaints for occupancy. Again, what we're seeing is a tremendous number of people in these businesses. 75% is the governor's order maximum, but more importantly than that is the proper distancing within these businesses. The purpose of the 75% is to allow room to properly physically distance within these businesses to ensure a safe environment. And that's the issue that we keep seeing. Beyond just the occupancy number, it's just the grouping of personnel and people inside these businesses that's causing an issue. So again, we encourage people and businesses to assist us in doing the right thing and providing a safe environment. We're happy to report, Mayor, that we've submitted 1,500 names to Methodist as part of the Phase 1 Alpha, as Director Williams mentioned. The tiers haven't been determined, the second tier, but certainly the first tier for vaccines has been determined. We've submitted 1,500 names for firefighters to receive the vaccine as part of the Phase 1 Alpha group. We're hoping we get 100% compliance in taking the vaccine, but it is voluntary. It's not mandatory at this time, and we'll have the numbers of firefighters that did receive that vaccine once those vaccines have been administered. Thank you.
Digital equity is one of the many challenges we have faced in Houston during the pandemic. And most schools are open now, but some students are still learning virtually and must do their homework at home, and that requires a reliable internet connection. And I know Councilmember Carlos Cisneros can speak to this because she chairs the committee dealing with education. I am proud to say that we have developed 2 programs in partnership with Comcast that will benefit those who need the assistance. Last week, City Council voted to launch an internet voucher program by using CARES Act funding. The Health Equity Response Her Task Force has partnered with Comcast to provide approximately 5,000 vouchers to qualifying applicants from now until December 20th of this year. This agreement will ensure qualifying applicants can continue to stay connected to the internet for education, work, and personal health reasons for 1 calendar year. The pandemic has highlighted the importance of quality internet service, particularly for those vulnerable populations who must stay at home to stay safe. The program will provide a lifeline for citizens that have struggled through the pandemic without internet access and a way to stay informed, connected, and safe during these challenging times. And for more information or to apply, you can visit houston.comcast.com, houston.comcast.com. And I also want to thank the Harris County Area Agency on Aging, the Mayor's Office for People with Disabilities, the Collaborative for Children, and Project GRAD. Also, the city and Comcast have worked together to help connect low-income families to the internet so they can fully participate in educational opportunities and the digital economy. Comcast today is announcing plans to equip 9 City of Houston community centers with Wi-Fi connected lift zones before the end of 2020. And for more on that and what it means, please welcome Melinda Little, Comcast Government Affairs Director.
Thank you, Mayor Turner, and thank you for your leadership during the pandemic. 2020 really has been an unprecedented year, and internet now more than ever has become such a vital part of our day-to-day lives. Not only are students having to learn from home every day on an online platform, but many of us, including me, are still working from home using platforms like Teams and Zoom. But because of the pandemic and the safety, many of us are also having to connect with our families at home during these holiday seasons. So at Comcast, we are really committed to digital inclusion and equity. We launched our Internet Essentials program in 2011. Internet Essentials, for those of you who don't know, is a low-cost broadband internet program that offers high-speed in-home internet with the Wi-Fi router for only $9.95 a month for those who qualify. We have continued to expand the qualifications, so now most low-income Americans who live in a Comcast footprint are eligible for Internet Essentials. We've also continued to expand speeds to keep up with technology so that people really can stay connected. But the one thing that 2020 has taught us is that even though we have done all these things, there is still more to do. The COVID crisis has put many low-income students in the city at risk for being left behind. It has accelerated the need for comprehensive digital equity and internet adoption programs. So because of this, we've expanded ways to connect to Internet Essentials. We're partnering with other organizations like the City of Houston to have them help sponsor students to be able to be on internet. We also have been offering 2 months free service to all new Internet Essentials customers since March, and I'm excited to announce today that we are expanding that to go through June 30th, 2021. The mayor just talked about the great partnership that we have with his Health Equity Response Task Force and providing approximately 5,000 vouchers for Internet Essentials for 1 year. We're super excited about that, but we also know that we need to do even more, and so we're partnering with the city to open 9 lift zones this year, and then we have many more lift zones that we're going to partner not only with the City of Houston, but with other nonprofit partners. These lift zones are facilities that are designed to provide safe space for children to come and do their online learning if, for whatever reason, they don't have at-home access to internet, or like me, just want to go somewhere else to do their work for a while, but it will be safe. The lift zones will be located throughout the city with the goal of helping local residents, especially vulnerable and at-risk populations who might not be able to have internet otherwise. Mayor, we are so grateful to you for your leadership in this space, and thank you so much for allowing us to be a partner.
Thank you, Melinda. And those will be 9 lift zones in 9 of our community centers. And I want to thank Area Aging Organization, Mayor's Office for People with Disabilities, for also helping to make this happen. The need for food assistance during the pandemic has also increased greatly. Over the weekend, I was out helping with a food distribution hosted by Mosque 45 in the 3rd Ward. But nearly every day in this city, organizations are working to meet the needs of families facing food insecurities because of a job loss or illness as a result of the pandemic. On Wednesday, this coming Wednesday, City Council will vote Councilmember Cisneros, Mayor Pro Tem, on $2,036,000 in CARES Act funding for the Houston Food Bank to meet the demand for food assistance due to COVID-19. Can't tell you how invaluable the food bank has been. No question that this contribution to them will meet the needs of many, many families. So that's $2,036,000 from CARES funding will be going to the food bank. assuming council votes for it. And sadly, there are cuts to funding and product at the federal and state levels that have the Houston Food Bank and others around the country facing produce and commodity cliffs in 2021. And to assure these decreases don't negatively impact the food and nutrition needs of our communities, the Food Bank submitted this proposal for CARES Act funding. Some have criticized the city for rushing to spend all the CARES Act funding, but this, like so many other programs, are not only justified, they are sorely needed. According to the Houston Food Bank, distribution has surged as high as 200% of typical service, with March through October 2020 showing a 49% increase in the average number of households served on average, comparing the same timeline to 2019 as a result of the pandemic. So we are doing our part to urgently meet these needs. Council will also vote on providing more than $130,000 in CARES Act funding for BARK. And during the pandemic, the city's animal shelter is seeing more people surrender their animals. The economic impact of the pandemic has in some cases limited the ability of animal owners to care for their pets, increasing the number of homeless animals in our community and animals in BARK's care. Since 2013, BARK has partnered with Rescue Pets Movement to find homes for over 47,993 BARK animals in no-kill shelters and rescue organizations in Colorado and across the United States. This week's item increases BARK's contract with RPM for an additional $131,475 to transport an additional 1,753 animals in order to help reduce shelter capacity constraints during the pandemic. To support BARK's socially distanced shelter operations, RPM increased its transport efforts during the pandemic. The funding will also support a Home for the Holidays initiative to collect stray animals from the streets and provide transport services for up to 500 animals during the month of December 2020. RPM's effort greatly helped BARK's ability to provide a safe environment for employees and the general public through the COVID-19 outbreak in the Houston area. And I believe there are some additional items on the agenda for BARK as well. So let me just stop there. Kind of covered a lot up to this point in time, and we'll take questions on any of the topics that we have talked about today. Steve Williams is back? Yes. Okay. We're all here.
How are you?
I'm doing
Questions?
fine. How you doing?
Good to see you.
Thank you.
So first question we have from us, KTRK. Yesterday, this might be for Chief Pena. Is he still here? Okay. Yesterday's fatal crash on 59 at BeachNut. HFD Union is saying that staffing issues led to delayed response. I know you spoke with Shelley about this a little bit yesterday, but any comment in particular about this issue?
Well, I'm glad you brought this up. So it gives me an opportunity to speak directly to the media. The goal is always to staff 100% of the units that we have available. We are in this situation, mainly, we are 220 firefighters below our optimal staffing level. And, excuse me, the mayor and council has approved additional funding for overtime to bring in people on overtime to fill these vacancies, with the understanding that we're moving to hire 280 firefighters this fiscal year. Now, the reason we're in this situation now, 180 firefighters were not hired at the end of fiscal year 19 because of the passage of Proposition B. In addition to that, we had higher than normal attrition in fiscal year 20. So 220 firefighters is what we're short, but we're moving in the direction to hire for those and hire above and beyond the normal annual attrition. So 280 is what we have budgeted for this year. And again, the goal is to staff every apparatus that we have in service. We have maintained every fire station open. Every ambulance is staffed every day, and every fire engine that carries water to extinguish fires is staffed every day. If we have a shortage of firefighters, of personnel not available for whatever reason, we mentioned about 140 are out of service right now for quarantine. They're not available for staffing. If we have a shortage of firefighters, then we start idling or browning out ladder companies, so we can keep the majority of the other units in service. Our primary service demand is EMS. So all our ambulances are in service, and all our fire engines are in service. And that's the goal, is to maintain those units in service to be able to service the need in this community.
And Chief Pena, I know you said that you guys had 105 occupancy complaints between Saturday and Sunday. What was the outcome in these situations?
Those occupancy complaints were responded to by our inspectors, and the situation was resolved on site. So when our inspectors arrive on scene, they are now a resource to the businesses to ensure that we're providing the education, the recommendations for proper distancing within those occupancies. The management in these businesses has been very receptive and compliant with assisting us in achieving those ends. Those that have not complied, then the only recourse we have at this moment is to refer those businesses to TABC. And TABC now takes the administrative steps that they need to take to ensure compliance with the governor's order.
When you say that the owners have been open to resolving, are you seeing an issue where they are pushing people out to get back to the proper occupancy, or?
It's not so much so when they're over occupancy, yes. What we'll do, especially if they're over the 100% occupancy, is we call dump the business. So put everybody out and then reload it with the proper number. We're not seeing so much an excess in people over the occupancy. What we're seeing is the lack of proper distancing within the business. And that's where the management has been very accommodating in assisting us to resolve the issue.
And this is maybe for you, Mayor. Any update on cases since Thanksgiving week? Are we starting to see a spike just yet in hospitalizations or the positivity rate?
I think you're going to start seeing that like this week and into next week.
Okay.
I noticed yesterday when I gave the number of more than 1,300, you could start seeing the beginning of the post-Thanksgiving Day celebration, so to speak. But I think, and hopefully we won't. Let me just put it that way. Let me be optimistic. Hopefully we won't. But to the extent we are going to see a surge, then I think you're going to start seeing it in the numbers being reflected this week and next week.
And we have a couple questions from KHOU. Is the city considering requesting extra help from outside doctors and nurses or the military? At what point would you do so? I assume that they're talking about with vaccination distribution.
Yes, as I said earlier, we're going to use a strategy very similar to the strategy that we use for testing. As you know, with testing, we were able to tap into both federal and state resources for that. And so that is an option. We're thinking that we won't need to go there probably until the spring.
And then also, is the city involved in providing security to vaccines as they arrive and travel from the airport to hospitals?
I don't know the answer to that.
And then we have a couple of questions from Fox. Is contact tracing for you, Mayor, still taking place in the city of Houston? Are only some cases traced? What challenges are officials facing when it comes to contact tracing, if it's still something like
We're continuing to engage in contact tracing. My boss told me last week that we could not reduce the capacity for contact tracing after December the 30th. And so we have grant dollars that we're going to tap into to ensure that we maintain the current capacity for contact tracing.
The contact tracing program is vital to us managing this virus. It is vital. And right now we have close to, 400 contact tracers. Even though the CARES funding is supposed to be appropriated and expended by the end of December, I will tell you up front is that I'm reserving a small contingency of that 405, about $10 to $12 million, just to make sure that we have enough for contact tracers, for our homeless population that's in our COVID shelters so that they can continue, not knowing when the federal aid, additional dollars will be coming. I don't want there to be any stoppage or any reductions in our contact tracing programs or testing programs or the assistance that we're providing to the homeless population. So I am going to reserve a small portion of that 405 as a contingency to ensure that those programs continue past December 31st.
Thank you, Mayor.
So no reduction in our contact tracing program.
Hi, questions from KPRC. Given the numbers and the fact that they are increasing, it's quite alarming. You just talked about the 8.8 positivity, an increase from last week. You wanted it at 5. The Texas Medical Center says the reproduction rate is now at 1.4 anytime it's over 1, really bad, and that's up from 1.1 last week. I mean, these numbers are not good. What are you going to do? You talked about a curfew. At what point do you do more, can you do more than just telling people to distance, to not gather for Christmas, for Hanukkah, for other holidays coming up, because these numbers are going up? And is this the Thanksgiving bump, or have we not even seen that yet?
I don't know if we've seen the Thanksgiving bump yet in its, let's say, totality. I'm sure some of those numbers are embedded in the numbers that we reported on yesterday, and may be embedded in even the numbers that we are reporting today. Certainly between this week and next week, we are going to see whatever surge is going to come from the extended Thanksgiving holidays. You know, I continue to look at all of the numbers in their totality, not just individually. And just like you said, the aura rate went up to 1.4, which indicated there is community spread. But at the same time, if you look at the number of people in our hospitals today, that number has come down from slightly under 1,200 to under 1,100. Still looking at the numbers that are in our ICUs, we're still in phase 1, and we're not in a surge right now. So kind of looking at all of those numbers. During June, July, and August, the number of people in our hospitals as a result of COVID-19 was about 2,400. So as of this morning, that number is a little under 1,100. If it reaches to a point, for example, where we are getting close to a little bit more than half, and I'm looking at all the indicators, and if they're all clearly going in the wrong direction, then yes. The one step that is within my powers to utilize that have not been taken by the governor would be like a curfew. And I've spoken to it. I've asked businesses, for example, to control your occupancy, social distancing, to mask up. Quite frankly, I don't intend to say it anymore. When I see the numbers, and I think an additional step will be taken, what I will tell you is that it will be taken. Legal has already taken the steps to prepare it. And at any point in time when I look at the numbers and I think it's time to pull that, to utilize that additional recourse, then I will do it.
But why wait, given that the increases are happening now?
Not like in June, July, and August.
Well, the numbers that we looked for, the number of people who were tested positive just last, mid-November, were as high as in July.
No.
From the TMC.
No.
That's what they just put up today on their daily.
No.
Yeah.
Trust me, I look at these numbers every day. The positivity rate in June, July, and August got as high as 23, 24%.
Not the positive. Well, the actual numbers, it was higher. That's what they put out on their graph.
In June, July, and August, the positivity rate in the community was as high as 23, 24%. The number of people that were in the hospitals, covering the 9-county region, was about 2,400. As of today, the positivity rate is 8.8% in the community. Last week it was 8.4. The week before then it was 8.8, and then it was 7.9, and so on, so on, so on. And so the number of people in the hospitals today is a little under 1,100.
So you're saying there's not one number that you're looking at, even though we do report every week the changes, the increase in there's not one number that's going to trigger the curfew?
No, there's no one number that you can look at. You have to look at the compilation. And even when the situations were as bad as they were in June, July, and August, I didn't go to the curfew. Okay, we didn't do that. So I reserve the right to do it based on all of the numbers that we are looking at. That is a nuclear option, and you will hurt not only your bad actors, but you're going to hurt your good actors as well. And so before I go there, I do want to look at all the numbers, and I do want to, and then I'll discuss it with the medical professionals and others. And if we have to go there, I will go there. But for right now, no, we're not at that point for me to pull that trigger.
Okay. A question for Chief Pena regarding the vaccine. You said you give a list of 1,500. Are those firefighters or staffers who have said, yes, I want it, or just people you think should have it?
So those are the people that would qualify for the Phase 1 Alpha group. So those
So they
are,
haven't said necessarily that they're going to, that
no,
they want it?
No. So we submitted the list. Methodist will be the one that's administering and managing those vaccines. It's not a little corona. They will be administering. They will. Gotta say it. Gotta say it without laughing. No. Methodists will be the ones that are administering that vaccine and managing that list. We submitted all those that would qualify, and those would be our paramedics, those that are on the ambulance, or are apt to be assigned to an ambulance. Those would be qualified as Phase 1 Alpha. Methodists will be reaching out to them within the next 10 days or so, and then after that initial contact, we'll know what percentage of those are accepting the vaccine.
And when was the decision made to not require the vaccine be taken, and why was that decision made?
Well, the vaccine is voluntary, and that's as a result of how we acquired or what the use of that vaccine. It's an emergency use vaccine, so we can't mandate the vaccine be administered.
So, thank you.
And that's why we're encouraging people to take the vaccine. And that's why the messaging, you'll be hearing a lot more as we move forward to encourage not only our employees to take it, but people in the community as well to take the vaccine. So that will help us to get on the other side of what has been a very, very challenging year. Before I close, I want to thank the people in the city of Houston and the businesses, individuals as well as the businesses, for being very cooperative. For keeping your mask on. I want to thank people who are in our city, living in our city, doing business in our city, for keeping these masks on and for engaging in social distancing and washing your hands. I want to thank those businesses, for example, who've reduced their occupancy in order to keep their customers and their patrons safe, and encourage people while they're in their businesses to keep their masks on and engaging in proper hygiene. So I want to thank people for doing your part, because quite frankly, when you look at the situation in other parts of the country, the city of Houston is still, relatively speaking, in better shape, although things can change in a hurry. Let me ask for your continued cooperation in doing everything we can as we approach the Christmas, Hanukkah, Kwanzaa, and keeping people as safe as possible. I know a lot of people will be doing online shopping. I'll be doing online shopping. But occasionally, too, I will tell you that I will probably be in the stores. But if they are too crowded, if one is too crowded, I'm going to come out and go to another. So I'm not telling people not to. I'm just saying be smart shoppers, be safe shoppers, because our businesses do need the business, especially small businesses. And so I'm simply saying let's enjoy the holiday season, but let's do it in a safe and respectful fashion, knowing that, the vaccines are coming, and in weeks and months we can be on the other side. So, let's patronize our businesses, okay? Let's do that, but we can do it in a very responsible fashion, and that's what I'm asking you to do. Let's enjoy the holiday season. I don't want us to take the joy out, so ho, 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 all that good stuff. And, I'll come in my, reindeer outfit soon. So, with all my elves. So let's be festive. Let's enjoy it. Let's bring down the stress level. And again, be mindful of the road rage. And what I mean by that, don't get into an argument with people who are driving. No arguments, please. I would not argue with anybody. So too much road rage, bring the decibel down, and then have a safe and enjoyable day. Thank you all so very much. Appreciate it. See.
Ok. ¿En español? Sí. Mire, en español, lo que el alcalde ha comunicado es que el porcentaje de personas positivas al coronavirus ha aumentado esta semana. Ahora estamos a 8.8% de la población que está positiva por el coronavirus. Eso es un aumento de la semana pasada de 8.4%. Así es que estamos viendo que el coronavirus está incrementando el número de personas que están infectadas, y lo que queremos pedir a la comunidad es que sigan practicando las recomendaciones de seguridad, que usen sus máscaras, que tengan la distancia física apropiada y que tengan una higiene apropiada también para poder asegurarnos que estemos haciendo lo que podamos para poder bajar el número de personas positivas. Aparte de eso, lo que comunicó el alcalde es que la vacuna ya viene en pie y esperamos que recibirlas en 1 o 2 semanas. Y el grupo que va a ser inmunizado, va a tener la vacuna, va a ser el grupo 1A. Y esas recomendaciones vienen del Estado. Y las personas que califican para el grupo 1A son las personas que están en los hospitales, también las personas que están en el medical field, ¿sí? Médicos. Nosotros, el Departamento de Bomberos, tenemos 1,500 personas que vamos a recomendar para que tomen la vacuna, pero a este momento es opcional, no es mandatoria, y eso es a causa de cómo recibimos esta vacuna. Es para uso de emergencia nada más y no la podemos hacer mandatoria, es voluntaria. Pero esperamos que la mayoría de las personas que puedan tomar esta vacuna cuando llegue, que la tomen, para poder empezar a vacunar a esta comunidad y combatir este virus. Sí, mire, lo que comentó el alcalde del toque de queda es que si el número de personas que están infectadas en nuestra comunidad sigue subiendo a un nivel que esté impactando el número de personas en los hospitales, entonces él está preparado para poner un toque de queda. Y ahorita no sé cuáles sean cómo lo vaya a implementar, ¿sí? Pero es algo que el alcalde está considerando, es algo que el alcalde ya ha comunicado con el departamento legal aquí de la ciudad para poder ver qué son las opciones que tiene. Pero no es algo que él esté preparado a hacer hoy, ¿sí? Lo que está pidiendo es, como dijimos anteriormente, si nuestra comunidad hace de su parte, pone de su parte para poder combatir este virus, que sigan las recomendaciones que hemos estado hablando, entonces ojalá y no haya necesidad de tener un toque de queda. Pero lo que él está considerando es el porcentaje de personas infectadas en nuestra comunidad y el impacto que tenga en los hospitales, en las personas que tengan que recibir atención médica. Yeah, thank you.